I am a chronic pain patient. I had my first back surgery at age 20. Afterwards, I was able to do quite well. I was able to complete college, and I also went to graduate school and earned an MBA. While I was in college, I achieved a 3.9 GPA, and on the graduate level for the MBA, I also did a 3.9 GPA. And normally I wouldn't mention these facts, but I just want to demonstrate that I was a very driven person, and I still am. When I became unable to work was in 2006. I had my second back surgery. Leading up to it, for I think it was about 2 weeks, I was rapidly losing the ability to walk. I was having to use a crutch. The surgery was necessary because I had very severe stenosis and a significantly herniated disc. And soon after the surgery, it became apparent that either something went wrong during the surgery, or for whatever reason my body was not healing properly, because I was not recovering at a adequate rate, and also I was in just really intense pain. Since that time, I've been unable to work. The primary reason is because I'm not able to be out of bed for longer than 2 hours. If I'm out of bed for longer than 2 hours, I suffer just very intensely. The pain that I have it's located in my back, it's located in both of my hips, and it extends down into both of my thighs. And when I have a flare-up, it will also go further down my legs and also affect the back of my legs. Let's see. And then I spent 4 years, 2006 to 2010. I was told by many doctors that opioids were dangerous and that they were addictive. So I took a stoic approach, and I just forced my way through the pain every day. And, often I was writhing in pain, and I was very depressed. And then around 2010, I saw a new doctor who convinced me to try opioid therapy. And for me, the opioid therapy, it did not have an extremely radical change in my life in one respect. I was not able to return to work. I was still stuck in bed most of the time. I can leave the bed for about 2 hours a day on a normal day, and if I push it past that, then I suffer quite a bit later in the evening, and I'm not able to go to sleep even with the assistance of opioids. But I do want to make certain, or make it clear, that after starting opioid therapy, that I no longer live in the extreme pain that I did for the duration of 2006 to 2010. That it hasn't completely eliminated my pain, obviously, but I'm just more in comfort rather than living a torturous existence. Recently, I was tapered on my medications. I was slightly above the CDC prescribing guidelines, and that has also had an impact on my life. have found that I'm not, just throughout the day, I'm not getting up and getting out of bed as much. I used to sit downstairs in a recliner. I used to spend more time with my granddaughter, playing with her, and my understanding is that she's upset that I'm not able to play with her as much. And my wife has mentioned to me that she's, seen the effect of the last 5 months. That since I've been tapered down, that I'm just spending a lot more time in bed. And that is just because I do not have adequate medication at this point. So I don't want to sound too dramatic, but in a sense, I'm becoming more of a prisoner to my bed, which is the way I was from the period of 2006 to 2010. So it's a very frustrating situation, and I hope that some sanity can return to the treatment of chronic pain patients. Thank you.